And the first ureteroscopy that's been documented in the history books was actually done in 1895. And he would have something called this wax tip catheter, which is this little thin wooden rod lined with silk. It's got wax at the tip, and he would slowly put it into the ureter orifice and kind of advance it up the ureter. And he would actually feel for vibration. So if there was a stone, he would feel a vibration. And sometimes he would actually put this rod in between his teeth, to sense the vibrations a little bit more. I remember the first year I joined the practice, we increased the ureteroscopy volume by about 40%. That's the good news. The bad news is that the repair cost that year was for reusable ureteroscopes was $700,000. We were hampered by these burdensome service contracts. We had about 12 scopes, I remember. Any given time, at least 6 of them were out for repair. So we were waiting 45 minutes, an hour, hour and a half in between cases for the next scope to be processed and sterilized. We got 5.5 uses out of each reusable ureteroscope, out of each repair. When we actually got the repaired scopes, quote unquote refurbished scopes back, some of them didn't flex very well. I remember I did a case where the scope only flexed one direction. So I had to actually turn the scope around 180 degrees to flex the other way in order to finish the procedure. So suboptimal conditions, to say the least. In 2017, the FDA reported 450 infection and contamination reports associated with the use of reusable urologic endoscopes, including 3 deaths. So using a single-use disposable ureteroscope completely eliminates the risk of cross-contamination from incomplete sterilization. Here in 2025, we made a decision as a health system to completely convert our entire disposable ureteroscope inventory to PUSEN. Every case starts with a new scope, right? Like, you don't have to worry about whether it's defective. You don't have to worry about suboptimal visualization. They're highly maneuverable with excellent deflection, 270 degrees, that you can reach extreme lower pulls that we weren't able to do before. Switching to PUSEN has significantly decreased our turnover time from the initial 45 minutes I had mentioned earlier in my presentation to now less than 25 minutes. We do about 1,500 ureteroscopies a year across all sites in the health system, 125 ureteroscopies per month. That comes out to about $1.5 million in cost savings. We've actually completely gotten rid of all reusable ureteroscopes in the health system. We only use the PUSEN for essentially all of our ureteroscopy needs.